Hey guys, this is Dr. Hub. Today we are going to focus on the gastric ulcer. So what happens in case of gastric ulcer? So firstly, the gastric mucosa is affected. This will be the skeleton of today's topic. So first, the gastric mucosa will be affected, and due to its effect there will be decreased mucosal defenses. This leads to the decreased mucosal defenses. So decrease in mucosal defenses, what does it result in? This ultimately results in case of ulcer. So now we are going to focus on how is the gastric mucosa is affected. So firstly, the systemic side effects. The systemic side effects, that is SS of systemic side effects of the NSAIDs. So all this will affect the gastric mucosa. So under this there will be failure to inhibit the acid secretion. So there is failure to inhibit the acid secretion. Next comes the inability to form mucosal cap after injury. So inability to form the mucosa cap. So the inability to form the mucosal cap, this is after injury. Next, there is a decrease in bicarbonate secretion. There is decrease in the mucus as well as the bicarbonate secretion, and there is decrease in the mucosal blood flow. There is decrease in the mucosal blood flow. So this was about the systemic side effects of the NSAIDs, which is affecting the gastric mucosa. Next, there are also the normal or decreased acid secretion. There is normal or the decreased acid secretion, and as well as gastric emptying, as well as a gastric emptying. So this also leads to affecting the gastric mucosa. Next comes the local mucosa inflammation. Local mucosa inflammation, and this is from the NCLEX. Lastly, the gastric mucosa, it may be affected due to the effects of the H. pylori infection. So there is the H. pylori infection. So what are the main points here? That is, the bacteria, it penetrates the gastric cells. So the bacteria, it penetrates the gastric cells. So it penetrates. So there is penetration. It penetrates the gastric cells and weakens the mucous layer and weakens mucus layer. So its mucus layer is weakened. And next is, there is also the cytotoxins. There is a cytotoxins. So what happens is, it leads to the epithelial cell injury and death. So there is epithelial cell injury as well as death. Then comes, there is cytokines. So this cytokines, it causes inflammatory changes in mucosa. It causes inflammatory changes in case of mucosa. And there is also the proteases degrade the mucus. There is also a role of proteases. Proteases, it degrades the mucus. Now we saw the outline, that is, all of this, it affects the gastric mucosa. So after the gastric mucosa is affected, what plays a role? So next in line will be the decrease in the mucosal defenses. So this leads to the decrease in the mucosal defenses. And what does the decrease in mucosal defenses lead to? So this ultimately what it leads to is the ulcer. So this was all about the gastric mucosa being affected and cause of the ulcer. That is about the gastric ulcer. To learn and grow daily like this, please do subscribe.